welcome to La Vida Las Vegas podcast. We're two physical therapists living the life in Las Vegas. I'm Dr. Erica.
And I'm Dr. Joe. We created this podcast for two reasons. First, to connect the healthcare, wellness, and fitness communities in Las Vegas. And second, to highlight all the amazing people we've met along the way.
Thank you for listening, and remember to take care of yourself.
Welcome to the show. If you'd
Thank you.
If you'd like to introduce yourself and tell us what you do.
Yeah, I'm Dr Zellers. I am a podiatrist, meaning foot and ankle specialist in Las Vegas.
Very cool. So what made you want to be a foot and ankle specialist?
So I broke my foot a couple times in high school and college. I used to be a pretty competitive tennis player. And there's a couple, it was just like mild stress fractures, but I kept having to go back to my podiatrist. And I was like, well, this guy, he fixes people. I'm like, this sounds pretty cool. Like I see people go in and they come out. I'm like, you're fixed. So I was like, well, I'll inspect this. So I followed him around for a couple of weeks and I'm like, yeah, this job is actually pretty cool. And I really like that you get to work with a lot of like athletes, which was something at that point in my life I was pretty much wanted to be involved with.
Excellent. And what has surprised you about being a podiatrist?
How many people do not know what the word podiatrist means? And they're like, do you work on kids? I'm like, no, kind of, but not just kids. One thing you don't think about until you're doing this job is how much people need their feet. Like my job will not go, there will always be a need because people need to get around. And it's just crazy how some conditions can be so debilitating to like activities and quality of life. So I think that was kind of a wake up call in residency. I just didn't realize, everyone pretty much at some point in their life has some achiness or some problems with their feet or ankles.
So what made you decide feet specifically though?
I'm sorry?
What made you decide feet specifically?
So to go into podiatry, it's a separate school than regular medical school. So you have two kind of options. If you go into regular medical school, you don't always get the specialty you want. You can want to be in orthopedics and sports medicine, but you can match in internal medicine. And instead of doing, sports and surgery, you're sitting in front of a computer. It can go a different direction than you plan. So with podiatry school, I knew on that track, I could get to where I wanted to be with more of like musculoskeletal and athletic conditions.
Very cool.
Do you, so as a podiatrist, this is probably something that not everybody knows about. You do surgical interventions as well, right?
Yeah. Mm-hmm.
Can you explain, what your practice is like and, what things you can do and training that you've had?
Yeah. So for a podiatrist, you go to your 4 years of undergrad, you go to your 4 years of podiatry school, and then you do a 3-year residency. So it's a lengthy process. But yeah, so then you have in residency, you can go into a more surgical oriented program, which I decided to do. And so when I was brought out here, that was one of my main roles in my practice right now is to be surgically oriented. So it's a realm of all kinds of things. Some people just do surgeries as kind of smaller, minor ones like bunions and hammer toes, little cosmetic things. It could still be painful, of course. And then there's always the more involved kind of trauma, ankle fractures, foot fractures, even reconstructing flat feet. It's a pretty big range. And then a lot of podiatric surgery does often consist of even managing infections surgically in the foot.
Is that a big practice now?
I personally don't do a lot of wound care. We did have another person in our practice who was more focused on wound care and like limb salvage. My role is a little more cosmetic, sports medicine, surgery. But I do it all, but it's not infection, that kind of stuff is not a lot that I do. Mostly it's either cosmetic or, like I said, athletic.
So what are some of the common issues that you would see?
I see plantar fasciitis like every other hour. So
Yeah.
heel pain, pain with first steps in the morning, mostly because obviously, as you guys know, we're not getting that stretch that we need to in those tight Achilles. So plantar fasciitis is huge. Ingrown toenails, also huge. Those are my two biggest ones. Ankle sprains are really common, especially when we're approaching the more active summer months. I think those are my big three.
So what's your favorite condition to treat and your least favorite condition to treat?
Oh, my favorite condition, it's actually pretty easy. You guys probably know this, the Haglund's deformity. It's a bump in the back of the heel near where the Achilles tendon inserts on the calcaneus. That's my favorite surgery, without a doubt. You go there and you get to shave that bump off, tighten that Achilles tendon down. Hands down, my favorite surgery. So I'd say that was my favorite condition to treat surgically. My least favorite, that's tough. I'm going to say amputations. Any amputation, just because I feel, there's a sense of sadness for the patient undergoing that.
So Eric and I both have worked in various medical settings, and I'll tell you, sometimes people have some nasty feet. So I'm sure that's a thing that you run into frequently, is that people take their socks off. And you're like, have you taken your socks off this week?
Oh my goodness. Actually, one time, it was actually about 2 years ago, I was working in Indiana. I had a guy who got admitted to the hospital. He hadn't taken his socks off in 9 months.
Wow.
It was, I will never forget that.
Do you think a baby was going to come out of him?
It had and he also had like swelling issues in his lower extremities. So the socks actually cut the circulation off pretty badly. All his tendons around the ankle were exposed. It was the craziest thing I've ever seen. But we went to surgery, we cleaned him out, we put some grafts on him, and he healed.
So. Give him socks back?
No more socks for you, sir.
Oh, okay. Wearing sandals for a while, huh?
Yeah, right.
One of my things that surprised me the most is you would see people in the hospital and their toenails would be so thick it would look like little pads of butter on there.
Oh my goodness. One time I had a lady who, this is kind of gross, and you're probably going to want to cut this part out. There were bugs living underneath her toenails. This was back in Chicago. So, but yeah, you see some crazy stuff.
Like maggots?
Yeah. Oh, I've seen maggots and wounds. Maggots actually make really pretty wounds. No, these were like, they're like little like ants almost. I don't know exactly what they were, but it was something.
Did she know they were there, or is that a surprise to her?
It was a surprise.
Oh.
And so like I had to play kind of cool too. And
yeah.
like, oh, I'm just going to clean these off.
Wow. So when you tell her, hey, you have your condition is called bugfoot, then what does she say after that point?
Well, she was like, I don't think she realized, and I didn't want to embarrass her. So I just cleaned it off as best as I could and just, kind of like went through like a little foot hygiene lesson. And I hadn't seen her after that. So hopefully it went well.
Or the bugs got her. Yeah.
Those little toe
good.
bugs.
Yeah, I haven't seen anyone that has bugs on their feet, at least not quite yet.
What is the foot hygiene? Like, what's your general education on like maybe things that people might know or may not know about what foot hygiene actually means?
Yeah, I see athletes' foot a lot more than you'd think, just because people, especially in hotter climates like this, or even just active people in general, your feet sweat a lot when you move. And some people even have sweating conditions, but throughout the day, your socks get drenched, So I always recommend, if you're going to be super active, you're going to be sweating at all, take a change of socks with you through the day, because that will just keep that, prevent that damp environment, that fungus and warts, those kind of things like. So I always recommend, keeping your feet clean and dry, always checking in between the toes. Those are the big ones. And then keeping the nails kind of even with the edge of the skin. And what's the big ones when it comes to foot hygiene? Always checking the bottoms of the feet, especially people with neuropathy, whether that be due to diabetes or whatnot. They don't always have the greatest sensation on the bottom of their feet. So you want to make sure, you're not stepping on anything, you're not developing a blister, developing a wound, etc.
So you mentioned that ingrown toenails are a big thing that you see a lot. Why does that happen?
There's a couple different reasons. Sometimes it's just in the genes, like just the way the genetics and the curvature of the nails. Sometimes it's from most of the time it's from wearing too narrow or too tight of shoe gear and kind of squishing those toes. A lot of people get it from bad pedicures when the nails aren't cut straight across and they're kind of cut kind of jagged into the sides of the skin. And then you can even get it from trauma, like you drop something heavy on the side of your toe and it squishes your nail in a little bit. So there's a variety of reasons.
And would you see a lot of that with like the pedicures? Like people have.
Yeah, even I got one foot pedicure, so I can't talk. Here
You dig it out yourself?
I tried, but it was a little too far. And I'm like, well, this angle probably won't end well for me. So, but luckily I know people who can do that.
It's us as PTs. We're like, we try to treat ourselves. We kind of like it better if someone else treats us. I guess it's the same thing with the foot too.
Exactly.
Yeah, from your standpoint too, I'm sure you get a lot of footwear questions as well, right? There's so many types of shoes, wide, narrow, whatever that may be. Do you have like for your just personal preferences, do you have a favorite shoe brand?
I do. I wear Asics almost religiously, and then my Nobles for CrossFit, don't get me wrong. But regular throughout the day, Asics, just because, I mean, every brand's going to have some good shoes, some bad shoes. And when you're looking for shoes, I call it like the bend test. You want to take your shoe and make sure you can't, twist it and manipulate it in all kinds of different directions. You want it to be pretty supportive and rigid. So that's always what I tell people to look for in shoes. I see that it's pretty across the board in Asics shoes. And they're really good for people for flat feet as well. I have flat feet, so that's why I recommend them. And then I also tell people, when they're looking for shoes, typically we size our shoes down a little lower than they should be. So if you have any, like, is this shoe too tight? It probably is. So making sure that we have that room in that toe box to prevent things like, ingrown nails or runner's toes, stuff like that.
As far as that, so there's also a lot of skin conditions. So you mentioned that athlete's foot is one thing that you see a lot of. What's also maybe some common things that you see that maybe like podiatrists, like sometimes people don't realize like, I should go to a podiatrist for this reason.
Yeah, absolutely. Athlete's foot, you're going to be looking for, sometimes you have little rashes in between the toes, but a lot of times it presents as like this red or scaling, flaking skin on the feet. People sometimes describe it as itching and burning. Another one is toenail fungus. I mean, that's really easy for people to get. Nails get thick, they sometimes get discolored. That's one thing I see daily as well. And another thing that it's not common, but something that people should know to kind of check out for is there can be melanoma on the foot. I've diagnosed it twice this year already. So especially people out in Vegas laying out, not you don't think like I should put sunscreen on the bottoms of my feet. Easy place to get melanoma from laying out in the sun repetitively. So those are probably my big ones to look at.
How about some common diagnoses? Well, I think that sometimes fungus can be diagnosed as different things. Like people look at it and it looks like it could be something else, or
a lot of people, think it's like dermatitis and they're putting like cortisone cream or something like on it, and that's really not going to treat it. And even most for your athlete's foot, a lot of the over-the-counter stuff just doesn't cut it. So just kind of a little FYI out there. And then fungal toenails goes misdiagnosed all the time as either trauma or even, from discoloration from repetitive nail polish application. Those are the big skin ones that go misdiagnosed.
How about you talked about having something with a narrow toe box can cause different kinds of condition. How about things like people that wear high heels all the time or people that wear kind of oddly shaped shoes? Did you notice that has any kind of effect?
Yeah, especially if there's any structural or biomechanical imbalances or abnormalities in their feet, it's kind of going to expedite that worsening of, certain conditions like hammer toes or bunions. It's going to definitely cause progression of deformities like that versus footwear with a little more room to it, less scrunching of the feet, less scrunching of the toes, and shoe gear with a little more arch support to kind of give a little more biomechanical control.
I saw someone before that they took their shoe off and it was a kind of a high heel and it looked really narrow and tapered. And she, I guess, must wear the shoes often, but when she took it off, her foot was exactly the same shape underneath. Like her toes were all smashed together and it looked like a perfect mold of the inside of that shoe.
That is terrifying.
Yeah, I was impressed.
But yeah, I mean, shoe gear like that will expedite deformities and progress them a lot faster than they should.
And what made you go with the Nobles over the Metcons or the Nanos?
I actually only tried Noble so far, and I love them. And I never thought I would because I have such flat feet that most shoes cause me discomfort. But those Nobles, once I broke those trainers in, now I've had them in many, many colors. Yeah. But I haven't tried the other ones.
I have to try a Nobles out. So I have like all Nanos, so I definitely have to check out those and see how I like them.
Yeah, be careful in the running with them at first, but once you break them in, you can use them for anything.
As far as your day-to-day goes, how often are you in surgery and how often are you in the clinic? Like, what's kind of that?
Yeah, I'm in surgery once a week typically. Usually I just have one surgical day unless, throughout the week something emergent happens, like there's an infection and a diabetic foot that could cause sepsis, stuff like that. Emergencies will go in sooner. Bag trauma go in sooner if you're on call or whatnot. But most of the time I just have my one surgery day and the rest of the week in clinic. So 4 days a week in clinic.
There's certain things that maybe like rituals that you have. You're like, all right, today's surgery day. I need to do X, Y, and Z. And I need to get in the mindset to do that.
Yep. I have a surgery playlist. I have like half a Red Bull right that morning of. I take my protein bar for like my meal. It's the same thing every surgery day. And I wear the same shoes.
What's on the playlist?
Yeah. Nothing PG.
No, not like Footloose or something.
Yeah. Although one time I did have an anesthesiologist who didn't like, it was like more current hits, a little more rap, and my anesthesiologist didn't like it, so he started playing Disney show tunes louder than my playlist. So
yeah. Pretty awesome. So what brought you to Vegas?
So I was living in Chicago, and it was about 2 or 3 years ago. I don't know if anyone remembers the polar vortex, but at one point the wind chill was -60 in Chicago, and they warned, like, everything was canceled. They're like, don't go outside with your limbs or extremities exposed for more than like 8 minutes at a time, or you can risk like frostbite. I think that was the day I was like, yeah, I think I'm done with this. So my friend worked at the practice that I'm at now, and she's like, why don't you come join here? And I did, and I love Vegas, so I'm excited I did.
Is that something you see as well, frostbite?
Not anymore. But I used to, yeah.
So what's the strategy?
I'm dealing with more like cactus needles or spines or whatever you call them. I remember I first got here and I was like, oh, I have to really think about that for a second. I'm coming from Chicago. We don't have any cactus needles and spines laying around.
Yeah, I kicked a cactus the other day. I got some needles in my foot from it too. I had to have a friend pull them out.
Yeah, exactly.
He's not a podiatrist though.
No. Yeah, even when I moved here, about a year in, I don't know if it's stung or bit, it was a correct term, but I got stung by a scorpion on my toe. It was actually a day before a CrossFit comp. I was like, oh my goodness. so many different elements out here.
Oh man.
These ones little tiny ones? Like those little small ones?
Mm-hmm.
Yeah, those are really common. Like, so when people come for exterminator, like they call exterminators out here, where I'm from is like, Georgia, so you get like palmetto bugs and people get cockroaches and stuff. Now here they come out and spray for scorpions. Yeah,
that was crazy. I was like, oh no, they're only outside. It was in my stairwell. So I was like, what is happening?
You seen any tarantulas yet?
No. Oh yes. Once I was hiking Red Rock, and it was like kind of calm, and I'm not gonna say cute, but it was calm, and it wasn't like really scary. Not like the scorpion. So.
Oh man. So my uncle, he goes out in the backyard with the black light at night, and he just takes his vacuum cleaner and just swoops him up. So if that helps you, maybe do some extermination.
I need to get a scorpion Dyson.
Yeah.
Yep, that's right. So what do you do in Vegas then when you're not working with people's feet and doing CrossFit?
I hike. I recently got legally married. I'm getting actually married next month. And that's it. I do a lot of reading, hiking, and CrossFit every day.
Yeah, what do you like reading?
I pretty much hit up that New York Times bestsellers list. Then I make sure, I see some on there that have been on there a while. I'm like, okay, this is good. So a couple times a month, I read a new book from the list.
Very cool. Have you done any audiobooks yet?
I like the actual feel of holding and reading a book. I tried audiobooks, it just wasn't for me. I tried the Kindle situation, it wasn't for me. I just like actually holding like a good old book.
Gotcha.
I think it makes a difference too. Like if you're reading at night, it's not on your phone, it's not on some type of device.
Exactly.
Yeah. It's also just nice to tactily like learn things.
Mm-hmm.
So you mentioned you work with an anesthesiologist. Is it the same one you work with every time, or is they kind of switch out?
Well, that actually was one of probably the biggest differences I noticed. Healthcare is a little different out here than it was back in the Midwest. Like when you went to do a surgery in the Midwest, the hospital, surgery center, anesthesiologist was already there. Here you have to, you contract, you kind of pick a group and they go with you to wherever you're going for surgery. So it's a little different.
So do you listen to Disney show tunes now with that specific one, or?
I don't know what happened. I haven't seen it since.
It could be something else.
Yeah. I think he must not have liked my choice in music and probably didn't want to do that again.
So what got you into CrossFit?
I had always wanted to try it. I've always been super active, like just kind of cardio, gym, some lifting, but not super crazy. I tried like Orange Theory, I tried F45, those kinds of things. I just wasn't passionate. I tried kickboxing. I always want to try CrossFit, but I was always so intimidated because I'm like, those people, are super strong. Like I'm never going to fit into the gym like that. And then it took me moving here and checking out Branded One. And I was like, this is actually awesome. I can do this. And my biggest regret is I was too scared and didn't start earlier.
What people don't realize too is it's very scalable.
Absolutely.
You could take somebody that can't even do a push-up and have them do push-ups on the wall.
Yeah.
It could be, it's pretty amazing. Like you could start off at having no exercise experience whatsoever. As long as you're in a gym that's going to have good coaching, then they'll be able to help you out.
Yeah. I mean, you can build up from definitely ground zero there.
Mm-hmm. When did you start CrossFit?
Oh, I've only been doing this a little over a year.
And how many pairs of those shoes do you have?
My fiance's in the next room.
Yeah. Those Noble shoes, I don't know what it is about those. I don't know if the colors are just very appealing, but the patients that I've talked to that wear those, they have multiple pairs of those shoes. They never have just one pair of Nobles.
Yeah, I started with like a plain black pair. Now I've got like highlighter pink. I mean, it just spirals downhill.
When you're going to podiatry school, or just like all your classmates just like in love with shoes and footwear?
That's actually a good question. I don't think so. I think we were so like into the world of feet and studying that once we were outside of classes and tests, we didn't even talk about feet. So
what's something that you feel like people can do a better job about in terms of taking care of their feet, or just knowing in general, like things that they can maybe do in their everyday life to have better foot health, if you will?
So my big recommendation, there's a couple of things. But first of all, it's a rule like I try to live by and I recommend for most of my patients, 75-25% rule. Basically 75% of the time, be in like a good supportive gym shoe, or somewhat like a gym shoe, something with not a lot of mobility to it, not a lot of heel to it, something with some good arch support. And the other 25% of the time, wear flip-flops to the beach, wear little wedges or heels out to dinner. Most of the time, try to be in a good shoe. It will slow down any biomechanical abnormalities leading to deformities. And the other thing is stretching, the importance of stretching. I wish I could just put that on a handout and give it to everyone. Because when we get like things like tight Achilles tendon, stuff like that, it's going to lead to a whole other slew of issues.
Yeah, for sure. We see people have super tight ankles and then they can't, that's why they fall over when they squat, even like they can't even get to the bottom of it because their feet just stop them.
Oh, absolutely. Absolutely.
So what are your thoughts too? I'm sure you get this question a lot, is orthotics. What's the thing about orthotics?
I swear by them. It really depends on your foot structure. People who overpronate, yes, absolutely, get orthotics. People who are in a neutral kind of foot position, you probably don't, you might not need them. People who have like supination issues, I'd recommend it. I'm big on orthotics because I swear by them myself. But not, there's a big range when it comes to orthotics. You have the stuff you get at the pharmacies, like Dr. Scholl's, you step on the scanner machine. That anything that you can bend like that is not a good orthotic. I say, whatever you do, don't buy your orthotics at a pharmacy. But you have some good over-the-counter ones from running companies. And then, of course, you have the next level, which is made custom to your feet. But those usually, obviously, are the priciest of the bunch. But you do have a slew of options. I always just recommend whatever you do, just don't get orthotics at a drugstore.
How about Walmart?
Nope, that counts as drugstore.
Okay.
In my head.
Gotcha. I'm glad I asked. So what are your thoughts on going barefoot or spending time doing that?
It's not for everyone. It's really quite dependent on your foot structure. Definitely not for people who overpronate, because your arch is just so imbalanced. I'm not completely against it, as long as your foot structure isn't an extreme in either direction.
Gotcha.
So what's something that you've learned and you wish you knew sooner?
Oh, that is so tough. I really, in terms of feet,
or just in general, like life, maybe like if you order something at Chipotle, like don't order that thing.
Or music recommendations.
Don't order anything at Chipotle. No, I'm just kidding. One thing that I've learned, this is so tough. There's just so many things. I have to think about that one. I have to come back with you on that one.
Okay. So what's your favorite cheat meal?
Oh, that's so hard. There's so many of them. I'm not even going to lie about it. I have a guilty pleasure. It's bad. It's McDonald's. Those chicken nuggets.
They're made with real chicken now.
I haven't tried that. I don't know if I could. If I go there, like, I'm going big,
What kind of sauce do you get?
The sweet and sour.
Thank you.
Sure.
Good answer.
What's something that you commonly see in your practice that you wish more people knew?
Or a couple of things. I often see people wearing shoes that are like, oh, it's got a ton of cushion in it and it's really soft. Like, usually that's a bad idea. Anything that is just too soft, usually not a good shoe. And it's just so hard. They're like, oh, this is Skechers. It was, they have the memory foam in it. That's not good to stand on for 10 hours a day. I think that I'd say.
You see those, I don't even know how long ago that was, but those Skechers rockers were, I don't remember, I think that's what they were called, right?
Yeah, I remember like they had like the rocker bottom to it.
Yeah, and like a lot of people fractured their ankles after wearing those.
I remember seeing that commercial. I'm like, well, that doesn't seem like a good idea.
Yeah, I think that actually did happen a lot. So I think I don't know if they still make them, but I saw a lot of articles about people fracturing, like coming off the curb or something, and just like
I haven't seen those in a while. Yeah, you lose a little. I mean, rocker bottom shoe is not for everyone. That is for sure. And then when you put some stamp on it, like podiatrist approved, when in reality it was maybe like one podiatrist somewhere who approved this.
Now is
people are like, oh, I'll buy it.
Is Dr. Scholl's like the king of podiatry now? Like, because he was like,
I probably shouldn't talk badly because I went to Dr. Scholl's school of podiatry.
You did.
I did. But it was just named after him. Honestly, I don't recommend Dr. Scholl inserts or anything like that. They're just, it's mass produced, like too mass produced. Like, the gel stuff, I usually recommend against it.
I gotcha. I've actually taken some arch supports out of my shoes, and it's been pretty cool to feel what that feels like. Like I had some Metcons, that's Nike Metcons, the first generation ones, and I would walk around and squeak everywhere I would walk.
You know what you do? You put baby powder on in your shoe.
Oh, okay.
I have no idea why I know that, but I
do. Those are great for when this was when PT school. So everyone's taking a test, and I could tell when Erica got done with the test, she'd hear her squeak her way out of the room.
It'd be really embarrassing. People would stop, look up, and just start laughing because I would just like squeak my way out of the room. Like, oh, sorry, guys.
I always wear these shoes. This is my lucky test taking shoes. So
that's awesome. What's
something that you've been working on professionally, personally, physically, or mentally that you're excited about?
Personally, I've been working towards this wedding planning situation. Planning a wedding during COVID was extremely challenging. We had rescheduled it 3 times. Oh, wow. So I'm just needing June 29th to get here, so I don't have to reschedule this again. And then as well, I mean, CrossFit has just become huge, and it's just been really amazing and really fun to just see where you start and where you're at right now, you know? So that's something I always set goals for, you know, pretty much monthly, to increase this or get better at that. So I'd say that's probably my second biggest after the wedding.
And what about professionally? What kind of stuff are you nerding out on right now professionally?
Wait, what'd you say?
I said professionally. Like what's kind of stuff you've been really into in terms of your practice, or like things you've been really reading about?
Well, I'm thinking about, they're coming out with, not just coming out with, but recently a trend has been minimally invasive, like bunion surgery. So, you know, a lot of times with bunion surgery, there's a slew of different procedures you can choose based on people's x-rays and their deformity levels. But they're kind of getting more and more into this minimally invasive route. And I think that's something that I would definitely like to look into a little more professionally, just because obviously smaller incision, a little less chance of infection, better scarring, and from what I'm hearing, even possibly a quicker recovery. So that's something it's a goal of mine professionally to achieve hopefully soon.
As far as someone who has maybe a problem with their foot or have some question about it, how do they know when to come see you? Or like, how do they identify like, oh, I need to see a podiatrist for this issue?
I'd say if it doesn't resolve, you know, for instance, if it's like a sports injury, if it doesn't resolve after, you know, a couple days, maybe a couple days to a week of trying like the RICE protocol, rest, ice, compression, elevation, then go see someone. Other things, if you try anything over the counter and you're not seeing progression, like skin rashes, nail stuff, go see a podiatrist. But yeah, definitely don't let things go, because they can progress.
Definitely. So what's something you've learned you wish you knew sooner?
Oh my gosh, I keep forgetting about that question, and there's a reason why. Something I've learned. I still can't think of this.
Doing CrossFit earlier?
Yes, I learned don't be afraid. Just go in, and you might not be good at whatever you're trying. You might be the worst in the class. But don't be scared. You'll get there.
Excellent. And what would you like to leave listeners with?
You're probably going to cut this part out. What do most people say to that?
I don't know.
Sometimes it's just like people's words of wisdom, or like things they like to live by, or like someone recently just said, find your fitness and however you want to do it. Just kind of like your philosophy on life, or the way that even professionally, maybe things that you think, hey, podiatry is actually a thing, and we see kids and we see feet and ankles
and kids' feet.
Pediatric podiatry. I guess what I would leave people listening with is just take care of your feet. You know, a lot of times, especially when we're a little younger, we think, oh, this pain will go away, or oh, it's fine to wear high heels all the time. Just take care of your feet, because those are going to be with you all of your life. Take the best care of them you can so they can be in the best condition they can as long as possible.
And how can people find you?
Our company just merged with a multi-specialty group. So we do, it's called the Docs. So we do endocrinology, internal medicine, even we have a dietitian and podiatry as well. We have office on Rainbow and Sahara. And then we have one over in Seven Hills area in Henderson.
And then the name of the practice is the Docs, you said?
The Docs, yep. And then DOCS.
Excellent.
Well, we appreciate your time today. Thank you so much for being on our show.
Thanks. Yeah, good seeing you. Hopefully I'll see you guys around town soon.
Oh, yeah. Thank you.
Excellent. Thank you.
We'd like to thank you for listening to La Vida Las Vegas podcast. We hope you enjoyed the time with our guests as much as we did. It would help us out so much if you could share, subscribe, or review our podcast, or any combination of the three. Thanks again, and remember to take care of yourself.